So when we look at patients that have type 2 diabetes and are considering bariatric surgery, there's really no better treatment than bariatric surgery for type 2 diabetes. The reason is, of course, that they lose weight, which helps immensely with the diabetic effects, but also that the rearrangement of anatomy in a diabetic after a gastric bypass accelerates how quickly their diabetes resolves. There's some specific endocrine effects that will cause their diabetes to go into remission within 24 to 48 hours after surgery. So when we looked at the impact of bariatric surgery on the entire body, it really depends on the patient as far as what their incoming comorbidities are. But we see improvement in the things that you would expect, like diabetes, high blood pressure, sleep apnea, reflux disease. But also we see improvement in anything that's related to inflammation. So even asthma and fibromyalgia and chronic joint pain improve substantially with bariatric surgery. That's because the fat itself actually induces a lot of inflammation throughout the body that then of course goes away after bariatric surgery, and so those inflammatory processes improve and those other conditions improve also. For the patient, they often feel like their body image has improved substantially because of the weight loss. But really the goal with bariatric surgery is to eliminate all those comorbidities so that people can expect a greater life expectancy. It really depends. I mean, there's of course a genetic component that won't change in a patient. So some people who may have high blood pressure, it's because their mom and dad and all their grandparents had high blood pressure. But taking the weight off will make it a little bit easier to manage. Also, when it comes to diabetes and other conditions, it depends how long they've had it. Certainly if there's been already damage to the pancreas from diabetes, it's probably not going to improve all the way. Just like if you have chronic back pain and severe damage from that, that's not going to go away just by losing weight.